Thank you, Chair. I confirm we're now live.
Thank you very much, and good afternoon, everybody, and welcome to this meeting of the Local Outbreak Engagement Board for Bracknell Forest. Before I ask for apologies for absence, or no, let's have the apologies for absence first, and then we'll do the usual roll call of those that are here. Thanks, Kirsty.
Thank you, Chair. I've received apologies from Abby Thomas and Peter Hayden.
Thank you very much. And so, colleagues, if you could please switch your microphones on so that you can say that you're here when your name's called for the roll call, please. Thank you, Kirsty.
Thank you, Chair. As is sometimes the case, people can have problems accessing a digital meeting, so anybody who doesn't appear in the call will have their apologies recorded. Members of the board, if you could turn your microphone on and confirm you're present when I call your name. If you don't respond, I will, obviously you won't be there, but I will record you as giving your apologies. Councillor Dr. Barnard.
Present.
Councillor Bettison.
Present.
Councillor Birch.
Present.
Councillor Brunel Walker. Andrew Hunter.
Present.
I've received apologies from Abby Thomas. Kelly Williams.
Present.
Elena Rozelle.
Just had a message from Elena to say she's lost her connection. She's hoping to rejoin as soon as possible.
Thank you. Gabby Hafner.
Present.
Acting Inspector Sophie Gardner. Fiona Slevin Brown. Philip Bell.
Present.
Other attendees. Timothy Whedon.
Present.
Shamaki Issa.
Present.
Councillor Mrs Hayes.
Present.
Councillor Harrison. I've received apologies from Councillor Hayden. Councillor Turrell. James Sunderland, MP. Adam Afriya, MP. Jerry Barber.
Present.
Mary Stamp.
Present.
Thank you. Is there anyone else present whose name I've not called? Thank you, Chair. That concludes the roll call.
Thank you very much, Kirstine. Thank you. That takes us then to agenda item 2, which is the standard declarations of interest. And any member is asked to declare any disclosable pecuniary or affected interest and the nature of it if they know of any. Does anybody wish to declare an interest in the proceedings today? And no, they don't. So I just give the standard reminder, please, that should anything, should the debate take an unexpected turn and you realise there is an interest, please don't hesitate to interrupt proceedings to register it. Kirstine, do we have any urgent items of business not on the agenda today?
Chair, I'm not aware of any urgent items of business.
Great, thank you very much. So then we move on to agenda item 4, which is the national and local COVID-19 status, to have an update thereupon. And Shamaki, you're down to give us this. Are you there?
Yes, sure, I'm here. Yes, I will share my
you.
screen now.
Thank you very much.
Hopefully you're all able to see my screen.
We've got that.
Just a moment. Yeah, so welcome to the latest Local Outbreak Engagement Board EPI update. I will start off by talking about the situational awareness, looking at testing, the case rates for the total population and case rates for the 60+ population. So for the period 20th to 26th of January, which is the latest period, we have data for the number of the case rates in Bracknell Forest is 1,501 cases per 100,000 population. That is up from the previous week. As we have a look at the other local authorities as well, the Southeast, we see that case rates are up in all those individual areas, with the national picture showing a decrease in cases. If we focus on just the 60+ population, we have 581 cases per 100,000 for the period 20th to 26th of January. And as we can see, for 5 out of the 6 local authorities, cases are up in that population, with Reading showing the only decrease in cases in their 60+ populations from the previous week. If we look at the Southeast picture, we see an increase in cases in this subset of the population, and in the national picture, we're showing a decrease in the cases in the 60+ population. If we have a look at the general situational awareness for Berkshire as a whole, for the period 20th to 26th of January, the case rate is 1,545.5 cases per 100,000 population, which is an 18% increase on the previous week and a 29% increase on the week prior to that. If we look at the graph showing the increase and decrease in cases since the 1st of July for both Berkshire as well as the Southeast in England, we're seeing that after a 2-week period of decreased cases, we're seeing an increase in the Southeast and in Berkshire over that period of time, as shown by the graph. If we break that down by the individual 6 local authorities, we're seeing that in all 6 local authorities, we're seeing an increase in cases after a period of decrease in cases. Moving on to Bracknell Forest as a whole, we are seeing that compared to the previous week, which was the 7th of January to 13th of January, that case rates have increased in Binfield and Warfield and have decreased in the south of the borough. For anyone who's interested in looking at the very specific case rates, numbers of cases for the week 14th to 20th of January, for the individual wards, we can see here that the largest number of cases and the highest case rate per 100,000 can be found in Binfield and Warfield for this period, which isn't particularly surprising given that since the start of the pandemic, March 2020, the number of cases as well as the case rate per 100,000 has been the highest in that particular ward. So now looking at the individual cases by age categories, where we get a better idea of which particular groups are driving the increase in cases that we've seen over this period of time, we're seeing that the highest cases per 100,000 at the 25th of January, which is the latest date we have information for, are the 5 to 9 and 10 to 14 that form part of our school age categories, with well over 3,700 and 3,300 cases in those respective groups. And if you look at the previous week's numbers for these groups, in both groups, the cases are up by 23% in the 5 to 9 group and 44% in the 10 to 14 group. If we were to look at the other group that are part of the school age category, the 15 to 19 group, we're seeing again massive increase of 63% week on week, with almost 1,500 cases reported for this specific age group. A more detailed breakdown of the number of cases per individual categories, we're seeing that as an overall picture for Bracknell Forest and the Southeast, we're seeing increases for most of the groups, particularly the 5 to 9, 10 to 14, and 15, 19 group, where we're seeing 23 to 63% increase of cases. We're also seeing corresponding increases in the number of cases in that particular group. An overview of the epidemiology of cases in Berkshire, which again highlights where we're seeing the increases in cases. For the period 5th of January to 18th of January, we saw that in terms of distribution of cases within the age groups, that the majority of the cases reported for that period were in the 35 to 64 group. And now what we're seeing in the corresponding groups for the period 12th to 25th of January, that the under 18 group comprise of the largest groups of individuals for whom new cases were reported, which again highlights the increase of cases being driven in those lower, younger age groups, under 18 groups. Quick overview of hospital activity and deaths. At the 20th of January, there were 20 new COVID-19 case admissions to the Frimley Health hospitals. And at the 25th of January, there were 148 patients in the Frimley Health hospitals with COVID-19 and 4 patients with COVID-19 who are on mechanical ventilation. We're seeing that over the past month for both number of patients admitted as well as the number of patients in hospital with COVID-19, that the numbers are either stabilizing or decreasing over a period of time. So the increased number of cases that we're seeing are not directly corresponding to greater numbers of individuals admitted to hospital with COVID-19 or in hospital as inpatients COVID-19, which is expected given the difference in severity between the Omicron variant, which is a dominant variant, and the Delta and Alpha variants before that. In terms of number of deaths, week ending 21st of January, there were no new COVID-19 deaths reported for Bracknell Forest individuals. Moving on to vaccinations, starting first with the dose 3 and boosters by local authority and age group up until the 23rd of January. We're seeing that some good news actually, that for Bracknell Forest, 86% of our 50 plus population have now had the dose 3 or booster, which is very much in the middle of the local authorities, with West Berkshire and the Royal Borough and Wokingham outperforming us, but we are doing better than the Southeast and England comparators. For the dose 1 and dose 2 coverage, 79% of our population are now vaccinated with dose 1 and 2, which again is very much in the middle when we compare ourselves to our neighbours within the within Berkshire, but we are again doing better than the Southeast and England. Previous week, Councillor Mark Brunel Walker wanted a better sort of look at the coverage in terms of vaccinations for the under 15 group. I've included a table here for the coverage at the 28th of January for dose 1, 2 and dose 3, as well as sort of an indicator of the increase in the number of individuals vaccinated for each individual dose. And we're seeing that where we're seeing the real gains in terms of individuals getting vaccinated is in the under 50 group receiving their dose 3 or their boosters, as well as the under 18 groups, so 12 to 15, 16 to 17 receiving their dose 2. I have included a graph here which just highlights really well the proportion of the population within individual age categories that have had dose 1 and 2, dose 1, 2 and 3 or a booster, and those that are unvaccinated. And we are seeing that as we go down the age categories and we're getting into all the age categories, the unvaccinated population is decreasing, which is a very positive sign over a period of time. Finally, I've included a map for the percentage of people under the age of 40 vaccinated with three doses, so dose 1, 2 and a booster, or dose 1, 2 and a third dose. And we're seeing that where we are doing really well specifically is in College Town, where 45% of the under 40 population have received dose 1, 2 and 3 or a booster. And where we need more effort essentially is in Priestwood and Little Sandhurst and Wellington, where the number of individuals who've had a dose 3 or a booster lagging behind on the other wards. Finally, in this slide, there's an explanation of the data thresholds for the different colors in the situational awareness table. Finally, for more information, you can have a look at slide number 16. That concludes my presentation. If there are any questions, I'm happy to field them.
Thank you very much, Shamake. Thank you. Colleagues, does anybody have any questions on that excellent update?
Chairman, if I may.
And welcome.
Thank you. My apologies. I was having some Zoom issues in connecting, so apologies for being late. Thank you for this really in-depth update, and thank you for breaking down the dosage information into this format. I hope it wasn't a huge amount of work, but I think it's a really useful table to see, to understand sort of where we are with the world. I guess my general comment or observation, because I listened to the Minister for Education, and I also, in my role as a counsellor, I talk a lot to some of our headmasters and our head teachers, and there seems to be a massive disconnect between the phenomenal job that's being done by all of our head teachers across all of our schools in Bracknell Forest and the almost diametric view from and you look at the numbers in here, and then the almost diametric view from the minister that says the pandemic appears to be over in schools and everything can be relaxed. How the hell do you show the numbers to a ministerial level that actually says the case rate in our schools is X, which seems to be at complete odds and variance to the excellent information we seem to be getting from the minister? And I'm looking at these numbers, and they're horrific. And I work with I mean, it's not the same, but a scout group. So we see beaver-aged, cub-aged, and scout-aged and explorer-aged children. And I think we've probably got somewhere between a third and a half of our groups are off right now through either isolation or because they've got it. And I'm struggling to understand how we land this message at a regional or national level to go, the school numbers are horrific, despite the incredible job that our head teachers and all of our staff, our excellent staff, are doing. I just don't understand how we end up with this, one view of the world that says it's great, the other view, the reality says the numbers are horrific. I'm not sure who to aim that rant at, but somebody somewhere in central government, surely they see this data as well. I mean, we can't be unique in the numbers that we're seeing in our schools.
No, absolutely. I think my colleague Kelly Williams is very much involved with communicating with head teachers in schools, and perhaps she could sort of give an overview. But I think,
and before you do, that wasn't a criticism. That wasn't a criticism of anybody in the excellent work that's done on this call. But it is the complete nonsense that we're being told one thing and our numbers show something clearly different. So please don't take it.
No, absolutely. It is there is a disconnect in the numbers being seen versus the messaging coming from central government. I think my colleague Kelly Williams is in regular communication with the head teachers in the schools and the UK Health Security Agency. So perhaps she would be able to chime in. I personally do not see the connection between what's coming out from government and what the actual numbers are saying, other than the fact that because of the significantly lower severity of the Omicron variant versus the previously dominant variants, they don't seem to have a concern that it would lead to more severe outcomes. But I think, my colleague Kelly or Gabby Hafner will be able to sort of perhaps chime in on that point.
Or even I could come in if you like, Chairman, on that.
Sure. Thank you, Tim.
Because I think the answer to Councillor Brunel Walker's question is that the government are perfectly aware of the numbers in the schools. They just have a slightly different interpretation on what on how best to deal with it.
Yeah. Thank you. I think it is it's a political slant and how they would like the world to be, rather than what necessarily the numbers are showing us it is like right now. Councillor Dr. Barnard,
thank you. And I think those numbers are interesting because they do play quite close to home. I think the first thing to say is that and maybe we can pick this up in some of the communications discussion, is that if mine and my family's experience is anything to go by, these symptoms of COVID crop up fast, and that, sort of twice a week testing isn't going to actually necessarily pick up whether anyone is COVID positive. And I think there are a number of other folkloric myths around. The first is young people do get COVID and do get symptoms, and it does not can wipe them out. So it's not symptom free in young people. And secondly, yes, it might be less severe, the Omicron variant, in others, but it's nonetheless still not particularly pleasant. And, I think every day for the last 2 weeks, whilst going through what many others have gone through, I thank the lucky stars I had the opportunity to have 3 vaccinations. And I shudder to think and have huge sympathy for those that get COVID and maybe haven't got that level of protection. Where I think this leaves my concerns, and it's sort of really distilling the previous sets of comments, is that I think our head teachers are under a huge amount of pressure because every action they are taking to try and reduce the transmission of infection in schools against a significantly reduced framework for the measures that they are allowed to take by government puts a significant amount of pressure on. And I guess my plea for anyone listening into this or anyone actively involved is, please cut some of the head teachers some slack. That what they're trying to do on an almost daily basis is balance the needs of making sure that classes are safely staffed, that the children in there, the risk of transmission is as minimal as possible when they have significant incidences of multiple infections in one class. And unfortunately, they have to focus on that, because I have seen and been copied into several emails from parents expressing huge frustration that with very short notice, their children haven't been able to attend school, but it's because it's not safe for them to do so. And that safety is a number one priority, and they're not being helped. And I think, Tim, you made a very good point. They're not being helped by the fact that central government is kind of intimating that there no longer is an issue. So, you know, in actually what I'm picking up, and others can comment on this, I think our heads are still navigating their way through this. There are numbers of members of staff that are off. There are still clusters in year groups and year classes where these infection levels are high. And significantly, and I know you said in your presentation that Omicron is less severe, it is still not pleasant. It is still by far and away the worst thing that I've experienced in a number of years. So, and, you know, and others in our family. So, you know, the key thing is we've just got to keep a watch on it. And maybe, Kelly, when we address some of the comms side is there something about trying to explore and explain that at the moment, having healthy suspicion if your child has a cough or it feels off colour, rather than just relying on the twice weekly test, is a good way of actually trying to make sure you knock it? Because I think from personal experience, if we'd not chosen to test at that moment in time, you know, potentially could have increased spread in the school. As it was, we all isolated, stayed away, and probably reduced that. Because I have been really struck, and I don't know if others have, by how fast these symptoms come on. You can be feeling absolutely right 1 minute, and then half an hour later feeling absolutely wretched. And, you know, even in the space of one day, you can go from a negative to a positive test. So I just put those points out there. You know, as it's encouragement, there's a huge amount of good work going on, but that our schools are somewhat constrained by what they can do and say they can do, and they're doing their very best, I think. So I don't know if Kelly wants to come back on any of that, or maybe Tim.
Kelly, do you want to come back?
Yeah, no, I'm happy to come back on that. I suppose I'll just echo everything you've just said, Councillor, there. I think that, as Tim's highlighted, a message coming out from central government is very different from what our head teachers are dealing with on a daily basis on the ground. They are doing an absolutely incredible job in almost untenable circumstances, and my hat goes off to them every day. I think in terms of the approach that we take locally, we've always tried to be as pragmatic as we can in terms of putting in place responses and measures that address the current level of risk. And our East Berkshire Health Protection Board has on a number of occasions deviated from central government guidance where it's been felt that the level of risk dictates that we do so. We are keeping it under regular review, and myself and other colleagues are in regular, almost daily contact with many of our head teachers in supporting them to implement the measures that are still available to them. There are still a number of measures available to them, and they are using them at every given opportunity. So all I can do is really echo the comments that colleagues have made previously in terms of, you know, if our residents are asked to do something by the head teacher of their school, whether that's wear a face covering, whether that's test more frequently, or adhere to any of the other measures within the school environment, then please do follow that advice and guidance. It's there to ensure that we're all kept as safe as we can be.
Can I just come back on something, Kelly? One thing I know that's been raised with me on several occasions is that because these things can change rapidly, that maybe parents feel pressurized to send their children into school because of other pressures, whilst than just stepping back and just trying to get that balance, because I really get both sides of this one. But ultimately, these symptoms are such that at the current time, and given the numbers we've seen earlier today, one has to have a healthy suspicion that a cough is COVID related. and I'm just wondering if that's where we need to explore more widely that sort of communication strategy, not just necessarily through schools, but through the whole community, saying, look at these numbers. And therefore, if your child does start coughing and spluttering at sort of 7:30 in the morning, even if you've taken a test within the previous 48 hours and you've got a kit, try again, because the result might surprise you.
Yeah.
I think that's where I'm coming from. It's a more general community thing rather than just through schools, that one.
Yeah, I think if I could come back, Chair.
Sure.
Yeah. Absolutely, yeah.
I think just really, again, reiterating a previous point about how absolutely understand and agree with everything you've said. Unfortunately, the national communications and the message coming out from central government slightly on that position. So we have to get that balance right in terms of the factual information that is distributed by central government. Having said that, our head teachers are very good at advising parents and carers of some of the other symptoms that they're regularly seeing in school, and encouraging parents and carers to keep an eye out for those, albeit that might be against the current government guidance and advice.
Thank you, Kelly, for really pragmatic and strong support. Thank you.
Yep, thank you. Dorothy Hay.
Yeah, I'll just carry on from there if you don't mind, sir. Kelly, it was just when you see the figures, oh, excuse me. No, I haven't got COVID, so I can prove it. I had to have a test yesterday. Having said that, when you see Binfield and Warfield, no, not Warfield, but Binfield with Warfield, as they say, they've been the main one all the way through. Is there some combination there that it's the schools crossing over from Woking or something? I thought I'd have it on the Windsor side coming in my section. Do we have anything that indicates why Binfield has been there continually at the top?
No. Yeah. Lee, do you have an answer to that?
So that's something that we've looked at, Councillor Hayes, in our outbreak management cell on quite a regular basis. I don't have a concrete answer for concrete answer for that. My colleague Gabby Hafner may come in after I've spoken, but there's lots of different factors that may have contributed to that. Not least of which some of those are behavioural factors in terms of the rate at which people are testing and reporting their testing. We do have high levels of testing per 100,000 cases in Binfield with Warfield, so it may be that more cases are being identified because of the testing rate as opposed to there being a genuinely high number of cases. Gabby, I don't know if you want to add to
Gabby, yeah.
Yes, as Kelly said, thank you, Chair, if you don't mind. As Kelly said, we did investigate quite thoroughly, Councillor Hayes, that blip in the numbers. And as Kelly said, I think it's a number of factors. I think there are a number of children visiting private schools outside of that ward, so there is a bit of traffic. I think there is some residents there are very diligently testing more, so therefore they are finding it more often. But we couldn't find a single reason for the blip, and I believe it's settled down a bit now.
Right. Thank you very much. Thank you.
Yes, thank you for that, girls, because it's something that once someone sees that they have been a particular area continually, it's just having that back in that you can say, well, yes, they're doing the same as us, and the schools are as good, in testing. Yeah. Thank you.
Fine. Thank you very much. Thank you. Well, if there's no further questions on that, and I don't see anybody indicating, so we'll move on to the item 5, which is communications and engagement update at both national and local level. And I believe that today is being given to us from Elena Rosell. Elena.
Excuse me, it is due to be presented by Elena, but just again, so I'll give it a go.
Okay.
There's a lot of worrying kind of coughing going on.
Kelly, as you've got a bit of a cough, would you like me to?
Yes, please.
Thank you. Thanks.
Just pull the presentation up one moment.
Have you got it, Gabby?
Yep, just coming through now. So hopefully that's working at your end.
Yes, it is.
So this is Elena's presentation about the communications that she's been working on, and her team are been working very hard to keep us all up to date. So the information that they put on most recently was the government's plan to revert back to Plan A, and the information that we need to know so that we're no longer required to work from home, and there's a change to the requirement for face coverings in schools within classrooms. But of course, as we've already discussed, our schools are experiencing very high rates, and her teachers are quite understandably using some discretion on that point. The second slide here is about vaccinations. So the comms and marketing team have been highlighting vaccination availability, particularly the walk-in availability at Waitrose. And you can see on the right-hand side of the screen that they've been advertising the vaccine bus, which started in Bracknell Forest yesterday. And I'm pleased to report that we actually had 23 vaccinations yesterday at the vaccine bus, which is currently at the canopy in close to Waitrose, and some of those vaccinations were first vaccinations and a number of school children. The vaccine bus is there for 3 days, and then it moves to Warfield Tesco's, and then we'll have the vaccine bus back for a few days later in February. And I think this message in the middle here is not too late to have a COVID vaccine has been particularly powerful, reminding people that it's an evergreen offer, and you can still have whichever vaccine is outstanding at any time, and how to facilitate that. On the testing message, they've provided a lot of clarity about which sort of test you need at which time, and that's with for those people without symptoms no longer need to have a confirmatory PCR test, and the messaging that they've been putting out about that has made that as clear as possible. They've also put some information that you can see on the right of that slide to do with how the self-isolation rules have changed, and that you now can undertake a test on day 5 and day 6, and if both of those are negative, you're then released from isolation. However, if you continue to test positive, then unfortunately you still need to continue to isolate. In terms of engagement, they've provided lots of messages to harder to reach groups in a number of formats and languages, ideally suited to those cohorts. They provided information on testing and vaccination to community groups and leaders, particularly there's areas with a higher footfall in line with the target audience, for example, pubs and barbers, to get the messages out to younger male demographic, as well as health facilities. And they've been making some progress with the local Gypsy, Roma and traveller communities to pull those messages together. And Elena's last slide is a thank you. And I think one of the reasons that the vaccination rate in Bracknell Forest is higher than the South East average is down to the great work from this team.
Thank you very much indeed. And what a great demonstration of teamwork. Thank you both to, finally to Gabby, who stepped up, and to Kelly for offering to step up, and poor Elena, who is clearly having difficulties today with connectivity. But thanks for that presentation. Does anybody have any comments or questions on that?
It's just Chair, just Chair, an observation. I think the communication's strong. I think it's about, just keeping to engage people. As we've discussed earlier, this isn't over in Bracknell Forest by a long way. And it's just finding as many different ways of just messaging that vigilance, I think, throughout for me, because people might think that it's getting less, but maybe we can just reflect on the fact that at the moment everyone seems to know someone that's got COVID again. Such is the scale of this, and it is avoidable. I think it is avoidable to spread it far and wide if we just keep our eyes on those simple things. Given that many of the mandatory restrictions have now gone back, it is common sense at the end of the day, isn't it? Trying to minimise levels of transmission. Yeah,
clearly that's right. I would like to congratulate our own team for giving just the right message all the time. It's not ever been unnecessarily scaring, but it's been firm, and it has, we've continually put out the right advice to our residents, and I'm very proud of the work that they've done. Elena, now that you seem your system seems to have settled down, do you want to add anything to that?
Yeah, thank you, Chair. Apologies. Thank you, Gabby, for picking that up. My connection is still pretty unstable, so hopefully you can hear me. I was just back on the point on Plan A, on the first slide that Gabby presented. One of the real tricky situations that we're in at the moment is very much what we've been discussing, that actually the national messaging does not marry with what we're trying to tell residents locally. So what we've been trying to do is, when we're giving out the changes that are happening, is almost making people aware that they still have choices. You can still choose to wear your mask, and that is probably still the best protection for you and your family going forward. If you go to the supermarket, if you're meeting with people that you don't normally meet with, just making sure that actually, just because the national messaging has changed, the health protection messages remain, that actually hand washing, mask wearing, testing and vaccination are still the best ways to protect ourselves. So while we have changed tack slightly, we are still making sure we're addressing those messages and drip feeding them out. I just wanted to bring that to the board's attention, that we're not, just because the national government say we shouldn't be putting those messages out, we are still doing them.
No, that's great. Thank you very much indeed, Elena. And we really appreciate the good work that you and your team are doing. Thank you. Fine, then we'll move on to agenda item 6, which is public participation. And I'd like to ask Kirstine if we've received any questions from members of the public.
Chair, there are no questions that have been submitted to the committee Dropbox in advance of the meeting.
Okay, fine. Then all that remains as item 7 is to review by exception the action log. Is there anything in there that requires review?
Chair, we have one item that we carry forward to each meeting, which is all board members to notify the board of any false or fake news so that it can be addressed and countered with accurate information. Item 2, which is outstanding from the action log, was covered by Shamarke, who provided the vaccinations breakdown data in the presentation earlier on. And then the final item that is opened is, previously it was described how there are unconnected sources of information and gaps of information that relate to vaccination availability and testing options in the borough. It was stated that it would be useful to have an accurate, up-to-date, real-time single point of truth source for all of the information relating to testing and vaccinations. And Councillor Mark Brunel Walker and Elena Rozelle were to liaise in order to identify if anything could be integrated as far as comms were concerned as a single information source.
Okay, thank you. And is there any update on that from either Mark or Elena?
Not since the last meeting. I think events kind of overtook in other places. I'll circle back with Elena tomorrow. Okay, all right, thank you. Thanks very much indeed. So we'll carry that forward. Right, colleagues. Well, if there is no further business for this meeting, I just remind everybody that our next meeting is due on the 1st of March. And so look forward to seeing you all then, if not before. And thanking you all for your participation today, and any members of the public that are with us also. So at that point, please, can we cease to stream?